Hi guys, welcome to Share Care program. My name is still remain Fumilayo Makijola. I'm so excited to welcome you guys to a program where we'll be exploring different type of health talk from different medical professionals. And so just try to watch this program to the end. If you're a pregnant woman or you have somebody that is pregnant around you, try to watch this program to the end because I know you will learn one or two things in this program. And today, I'm so happy because of my girls I'm seeing here, because of this face I'm seeing here. I'm so happy because I know you guys will learn a good thing in this program today. And my guest is here with me. Good morning, ma'am.
Good morning.
Yes, so welcome to Share Care program. I want you to
Thank you.
greet my viewers. You tell them your name and your profession.
Mhm. Good morning, viewers from everywhere. So, my name is Salma Abubakar. I'm a dentist by profession,
What
dental surgeon.
What do you have for us on this program today?
So, today I have a topic called cleft palate, or we can call it cleft lip and palate. Yes.
What is about the cleft lip and palate? Because I want my viewers to know the meaning of cleft palate and lips.
Okay. When we say cleft, it means there is a discontinuity in a skin. So it means it is a gap, or we say it maybe maljunction, or is it how am I going to put it in a layman? Discontinuity or malunion or a gap in a skin. That's cleft. So it can occur in every part of the body. So, but today what we are concerned about is the facial cleft. So sometimes you can even have it in the face, like the whole face, maybe one side of the face is not joined together and you see a gap, that's a cleft. So, and sometimes it occurs on the lip, either most commonly is in the upper lip. So you find that the upper lip there is a gap in between. Instead of it to continue straight like this, then you find it there is a gap in the lip, or that gap might continue inside the mouth to the palate, where the discontinuity will be up to the palate. If you open the patient mouth, you feel that it is open. The gapping is up to the palate. That's the roof of the mouth. When we say palate, it's the roof of the mouth. So you find it is open. And sometimes it can be only on that palate, only on that roof.
Okay.
You find that there is a hole.
It will not that one it will not affect the lips.
Yes,
It's
that
only
one
the
it will
palate.
not affect the lips. It's only the palate. And sometimes it goes together, palate and lip together. And sometimes you can find only the lips, just at the lip, not going back to the palate.
What is actually caused, like what caused this cleft palate and this
So
cleft
there
lip?
is different causes. There is what we call gene factor. Maybe the child will inherit from the family of the mother or the father if they have that gene that causes this cleft. So it can be inherited, that's from gene, or it can be due to associated risk factors, like maybe if the mother is smoking, or if she's taking alcohol during the pregnancy, or if she's using herbal medication, or if she has iron deficiency, like she have some deficient in her diet, like her diet is no balance, she don't have folic acid, or if she's not taking her medication, those vitamins that they used to give during pregnancy, it
If they are not
also
using it,
helps. Yes, if she's not using it, like if she's not using folic acid, it can also cause lack of it, or lack of other vitamins.
okay.
Mm.
Okay, what are the clinical implication of this
So
cleft?
the clinical implication of this cleft is that it affects the patient's speech. When the patient is talking, you can see he can't be able to, especially if it goes back to the palate. And you know there is some sounds that we pronounce with the lips,
Yes.
like the ba, the ma, and etc. So it affects the speech of the patient, the function, and sometimes the teeth will not come out at that space, because you know when it goes through to the palate, you know it affects the gums of the teeth. so there will be no teeth in that place.
What about the eating? Can
And
the
yes,
child
that's
be
the
eating?
function,
Okay.
like the biting, especially the front teeth that we use for biting, tearing, etc. So it will be difficult for the patient, especially if you don't have teeth on that space.
Okay. What
Mm.
about the psychosocial effect?
Yes, the psychosocial effect, it will be so difficult for the patient to interact with people in school, and because of aesthetics, because some of the some of the children, they will be so shy, and maybe their friend will be mocking at them. They will be showing them like they have this and that, and aesthetics is very important. Like
Yes.
they said, it used to measure the attractiveness of the child, the intelligence, the personality, and the social skills also of the child.
Okay.
Yes, that's for aesthetics. Mostly that's the self-esteem,
It's true. It's
develop
true.
that
You
self-esteem,
will not have the
the
confidence.
confidence, yes, because of that thing. Yes.
But is it when they are the possible treatment now? How can they be treated?
Yes, they can be treated, but when they are 10 months, no, 10 weeks after birth, 10 weeks, and when they reach certain weights like 10 kg, they reach 10 kg, 10 weeks, and they have enough blood of 10 gram hemoglobin, so it's curable. They
Okay,
can undergo
if they are 10 weeks,
surgery.
they are
Yes.
10 weeks, but they are not up to this 10 kg. They
If they are
cannot do
not
it.
up to 10 years, they can't do it because it's a surgical procedure.
Okay.
So they need to be strong enough to withstand the anesthesia.
Is it only a child that they can do this thing for? Some people they don't know anything about this cleft palate.
Yes,
Some
even
people they will
if
think
the
it's a monster, like the
no.
baby is a monster or
Yes,
is a
that's why,
bastard. You
yes, some
understand?
people used to think of if they see it, but it's not something to worry about. It's like it's common. We usually see people with it, and it's curable.
Okay.
And once they are cured, you not even
Notice it, you not
notice,
see.
it's only discussed. So, and the treatment is free.
Okay.
Yes, the treatment is free.
You guys are hearing this that the treatment is free.
Yes, the
Okay.
treatment is free for
But not
cleft.
all state though.
Not all
Not
states,
all
but
states.
almost other state, they used to have this organization of Smile Train. So they used to carry out the treatment, especially now that our consultant is doing it also in Gombe. He's doing free treatment for the cleft.
The most place I know is in Gombe.
Yes,
Because
it's
don't go to
Gombe.
your hospital and be saying they are doing this thing is free. This
Mm,
treatment is
yeah.
free. If you want to do it, it's in Gombe. I know
Yes.
that one for sure that they are doing it in Gombe and it's free
Mm.
in Gombe. So you guys have to hear this thing. But there's something I want to ask. When the child is more than 1 year, maybe they don't know. They don't know that
Okay.
they are doing surgery for it. If the
Mm.
child is more than 1 year, they cannot still do the
They can still do it.
okay, they can still
Yes,
do
they
it.
can still do it.
Okay.
Even if the child is grown up to 10 years, they can still go for the treatment. It's a surgical procedure. Just that, when he's a child, is more better.
Okay, yes,
Yes,
yes. The
that
pain is
the
more lesser.
yes, it's more laser because at that age he's still growing. Yes, but he can still go for the treatment.
Thank you so much, doctor. Thank you
Okay.
for coming to this program. I hope if
Thank
I call
you.
you next time to come and enlighten people, you will still come and answer us.
Yes, by God grace.
Thank you so much. You
Thank
guys
you.
have heard this thing on this program. You have heard the cleft palate. I've learned a lot about this cleft palate. My own advice for the mother and the father, because some father they will be thinking, my wife give birth to this child is a bastard. No, your child is not a bastard. It's normally occur. And a mother, if you give birth to this type of child, don't think my child is a monster. No, it's not a monster. Show them love and go for the treatment. You just go to dental clinic. If you know that you can afford the treatment, you can go for the dental treatment. You go to dental department, they will do everything for you. But there is a particular NGO that is doing it. But I don't know, maybe other states are doing it. But in Gombe, there is a particular NGO that is doing it. If you need my help, you can contact me. You can comment and share and like my program. In the next video, I will see you guys. Love you guys. Bye.